More than 29,000 people. It's a big number. It's the number of North Carolinians who died from COVID. And I know sometimes big numbers like that can be difficult to grasp. So think of it this way. It's the same number of students, undergrads and graduates who attend UNC. WRAL's data journalist, Ali Ingersoll, explains in that number, some groups were overrepresented.
If you look around our state, your community, and survey what the population looks like, you'll find that just over half of the people are women. Most residents, 62%, are white. And the majority of people, 21 out of every 25, are younger than 65. But the makeup of who died from COVID looks a bit different. A larger share of the people who died were men, 70% were white, and 76% were over 65 years old, according to DHHS.
Keep in mind all the people who died were undoubtedly part of a family. They have parents, children, brothers, sisters, and others. So there's been an enormous toll on people.
That's Dr. David Weber with UNC. He says the increased number of people who died was difficult to deal with as a provider.
None of us go into medicine not to have successful outcomes and save people.
There was an 18.5% increase in deaths among all people in the United States in 2020 compared to the year before, data shows. But men and certain racial and ethnic groups saw disproportionately larger numbers of community members dying during the first year of the pandemic. Here's the table. Let's start by highlighting gender, male. From 2018 to 2019, there was a 1.05% change in the number of people who died. An increase, sure, but nothing too notable. That next year, though, more than a 20% increase. That's just one example, as you can see. Every other race and ethnicity group besides white saw a jump greater than the national increase.
This is all due to disparities and increased risk and a lack of access to health care.
Weber says the pandemic highlighted how we need to reshape our systems so everybody has equal access to care. For WRAL News, I'm Ali Ingersoll.
Now, since COVID was downgraded and is no longer considered a pandemic, that happened in May, the state stopped gathering demographic data related to COVID deaths and cases.